Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our video series for parents. Please remember that these videos are not intended to replace visits to your physician. If you have questions, we're happy to see you in our office. We can get you in the same day at area code 775-359-7111. But remember, we really can't treat you over the internet or over email or by telephone. That's not in the best interest of your child. That's dangerous. Today what we want to talk about are the differences in specific groups of doctors that care for children, and specifically we want to look at eye professionals for children or vision professionals for children. They really come into two groups, and it's important to distinguish between the two of them. There are optometrists and there are ophthalmologists. And they're very different, and you need to understand them. So everybody has the same undergraduate or college education. We take the same prerequisites for both schools. Somebody who goes to optometry school then goes to school for 4 years, learning about diseases of the eye, and mostly that's all they're going to study. And a good chunk of their time is spent learning about lenses and glasses and bending light and refraction, which is bending of light. They learn a little bit about medications, and they use limited medications. Optometrists, depending on the state that they're living and working in, can prescribe a certain amount of medications like antibiotics, steroid drops, pressure drops, medications to dilate the eyes. But they can't treat significant eye diseases, and they cannot do surgery. That last part's very important. Let me say it again. They cannot do surgery. They're good at prescribing glasses. That's a huge chunk, and contact lenses and stuff like that. That's a huge chunk of their training. They're good at recognizing diseases in the retina and the back of the eye, like diabetes complications for adults. But they can't treat them. They need to refer them off to an ophthalmologist. So what is an ophthalmologist, and why am I talking about this today? Ophthalmologists are physicians. They go to medical school. So after college, they go to medical school. They take the exact same prerequisites. The first 2 years of medical school are identical for them as they are for your obstetrician gynecologist, your pediatrician, your internist, your general surgeon. The last 2 years of medical school are very similar for all doctors. And there are certain core rotations that all doctors, core areas of the hospital that all doctors rotate through regardless of what they do for a living after that. And then we have certain electives, and most people who want to be ophthalmologists will take their electives in ophthalmology. After graduation from medical school, ophthalmologists then do a 5-year residency in ophthalmology. And that's all they do is care for diseases of the eye. But remember, first, they were a surgeon. First, they went to medical school. They studied the entire body and how all of those diseases interact to bring you diseases of the eye. During their residency, they learn how to care for diseases of the eye. They do learn how to prescribe glasses and whatnot. After their residency, they can then go back for additional training between 1 to 3 years in various other fields in ophthalmology. And specific to this discussion, certain ophthalmologists will go back for a fellowship in pediatric ophthalmology. As far as vision professionals for children, the only ones who have any specific training in diseases in the eye for children are pediatric ophthalmologists. Everybody else is treating children like they're little old people. There are some people who are okay with that, and they actually do okay for most things. They're comfortable with children, but it's not just about your comfort zone. Your fellowship is not about learning how, their fellowship is not about learning how to decorate their waiting room and their exam rooms to make it child friendly. And it's not about learning how to do a basic eye exam on a child who doesn't know his ABCs and can't look at the chart and tell you if that's an A or an F. Their fellowship is about learning about specific diseases of the eye for children, how to examine the eye in a nonverbal child, and to determine visual acuity and if you need glasses in a child who can't speak or won't speak, and doing surgeries to repair diseases of the eye specific to children. Consequently, for most of my younger patients, kids under 5 or 6 years of age, if they need glasses, if they're failing vision screening here, if we're seeing problems that concern us with their eye, we're very specific. We want you to see a pediatric ophthalmologist, not a pediatric optometrist, because there realistically is no such thing as a pediatric optometrist. There are just optometrists that like children. The pediatric ophthalmologist has very specific training to help your child. And your child doesn't necessarily even have to be able to talk to them. Now, pediatric ophthalmologists are few and far between here in Reno at this point in time. In 2012, we have 2. Fortunately, they're very good, but we only have 2. And a place like Los Angeles, where I trained, probably had 30 throughout the entire county. For those of you not familiar with Los Angeles, LA County represents something like 3 million people. It's huge. It's 20 pediatric ophthalmologists in a community that large. It's not a whole heck of a lot. But when it's your child's vision, you only get one chance at it. You need to see the best. And that's where these people come from. Their training is intensive, it's lengthy, it's a minimum of 6 years after medical school. And all they do is treat diseases of the eye for children. Where they're concerned, they're not short adults. They have different diseases, they tolerate medicines differently, those medicines are dosed differently, the surgical procedures you need to do for them is different, the way you examine them is different, the techniques are different, the machines are different, and it's not just that they're smaller. So if your pediatrician says that he or she recommends you see a pediatric ophthalmologist, take that to heart. See the people they're recommending. Chances are, in a giant city, there's only 1 or 2 of them available. But don't shortchange your child and bring them to the wrong physician, or wrong specialist. Now, having said that, for myself, I see an optometrist. And I have horrible vision. Because of my vision problems, I'm at high risk for retinal tears. But my optometrist is more than qualified to handle my problems. And I love him to death. He's a very nice man, and I refer a lot of teenagers to him who need glasses. But for younger patients, we need to be very careful. So I'm not putting anybody down here. Just delineating the differences, and it's important to recognize those differences because they are real, they are distinct, and they make a difference in the quality of the care of your child. Don't shortchange your child. So I hope this has helped to be educational for you. I'm Dr. Kevin Windisch at Sparks Pediatrics and Adolescent Medicine. If we can help you, give us a call at 775-359-7111. We'll see you next time.